This is the biggest myth that I see in healthcare. When you seek out services, you have two options. One, you can be passive and trust the system, or two, you can be active and take advantage. When you take control of your healthcare, you control the health outcomes. When you take an active role and champion your healthcare, it changes everything. And with something as important as yours or your loved one's health, this is the number one most important thing you can do to change your outcomes. When you take an active role in championing your healthcare, it changes everything. And with something as important as yours or your loved one's health, this is the number one most important thing you can do to get back on your feet, get the best care that you can, and get back to living life. So what does this really look like in real life? I like to call it the persistent patient. This is that patient or caregiver that walks into every single doctor's visit with a clear goal or objective in mind. This is the patient that understands that their health and healthcare services are their responsibility and within their control. The providers and care teams are simply there to guide them in the way that they dictate, in a way that fits with their goals and their life. And hey, guess what? Everything in life isn't planned. So the persistent patient is nimble on their feet. So even if they end up in the ED or the hospital, they ask lots of questions and understand that their care team is their partner in getting health and getting back on their feet. Hey doc, yeah, that diagnosis sounds good. Now what can I do to prevent this in the future or better manage it here today? Hey doc, yes, I need this procedure. I'm fully on board. But what can I be doing between now and then to make sure I can have the best health outcomes? What can I do from a physical standpoint, a mental standpoint, any equipment I can get? What kind of support will I need? What will I be surprised by? This is the persistent patient. And the best part about being the persistent patient is it doesn't require a ton of time and effort. It's a mindset so that you can be conscious, intentional, and confident in those situations. The reason this works so well is because your providers are on your side. Most clinicians and providers went into the healthcare field because they want to help people. So with that, when you're coming prepared and asking lots of questions, they love to see this because they see that you recognize that you are a very active role in this partnership. So if you go into that provider office not prepared, he's going to ask you, hey, how's it been going? What's been going on? And if all you do is rattle off a few things that are top of mind, that's terrifying because he or she is working hard for you. They're taking all those little tidbits of information to come up with a diagnosis and a treatment plan. So if you aren't giving them the right information and they come to those conclusions, that's honestly terrifying. So the takeaway is really simple. If you're frustrated with your healthcare, start taking a more active role in it. Because so often we're just brought up on this notion that, hey, the healthcare system, it'll take care of you. But I'm here to tell you that it won't. So start taking a more active role in your care to get the health outcomes you want because your livelihood depends upon it.